In this video, we shall review the benefits of intermittent fasting for diabetic patients. Watch till the end to discover what you need to do with your current medication when you start on an intermittent fasting plan. If this is the first time on this channel, please click the subscribe button and hit the bell icon to select all notifications, so that you get notified of new videos to transform your health. Intermittent fasting is currently experiencing a surge in popularity among American households, potentially rivaling the widespread appeal of calorie counting and plant-based diets. What's driving this trend? Emerging research indicates that simply restricting the time available for eating can naturally reduce overall food consumption, sparing individuals the laborious task of meticulously tracking every calorie. New research now reinforces the argument that intermittent fasting, specifically the practice of limiting one's daily food intake to a specific time frame, can serve as a safe and effective strategy for managing type 2 diabetes. The study, published in JAMA Open, provides compelling evidence that individuals with type 2 diabetes can effectively shed excess weight and regulate their blood sugar levels by confining their daily food intake to an 8-hour window. Dr. Joanne Bruno, an endocrinologist at NYU Langone Health who wasn't involved in the study, remarked, "I think this is pretty exciting data. Intermittent fasting has been found to be as effective for long-term weight loss as calorie counting, although it's still an emerging field with growing clinical evidence supporting its potential to improve metabolic health and induce weight loss. However, few studies have focused specifically on its impact on type 2 diabetes." The findings underscore the potential of time-restricted eating in aiding individuals with high blood pressure, elevated blood sugar, and other issues affecting cardiovascular and metabolic health, according to Dr. Pam Taub, a cardiologist at the University of California, San Diego. The study, conducted at the University of Illinois Chicago, spanned 6 months and involved 75 adults with type 2 diabetes. It was the first randomized controlled trial directly comparing time-restricted eating to calorie counting in type 2 diabetes patients, assessing their effects on body weight and A1C levels, a test that measures blood sugar levels over the past 3 months. Overall, the study discovered that time-restricted eating led to approximately the same improvements in A1C levels as calorie counting. Both groups experienced a reduction of over 0.7% from their baseline levels over 6 months. This change is considered significant and can yield meaningful clinical benefits, particularly when compared to the modest effect of most diabetes medications, which typically reduce A1C levels by about 1%. The most remarkable outcome was the difference in weight loss. Those who restricted their eating to an 8-hour window, from 12 p.m. to 8 p.m., lost nearly double the amount of weight compared to those who counted their calories. Krista Varadi, a professor of nutrition at the University of Illinois and the study's lead author, expressed her surprise at this finding. She noted that her previous studies had shown similar weight loss between time-restricted eating and calorie counting. The study also included a control group that made no dietary changes and a group instructed to reduce calorie intake by about 25%. On average, those adhering to an 8-hour eating window lost about 10 pounds and more fat than the calorie counting group, which lost a total of around 6 pounds. The participants in the time-restricted eating group found this approach to be a refreshing alternative to counting calories, having spent years disillusioned with calorie counting advice. Despite being the largest clinical trial on type 2 diabetes to date, the study is still considered relatively small. Nevertheless, it was well executed and included a diverse group of participants, primarily Black individuals, with a third of the participants being Hispanic. Additionally, those who practiced time-restricted eating had excellent adherence, sticking to the 8-hour window about 6 out of 7 days a week. Benjamin Horn, an epidemiologist at the Intermountain Heart Institute and an adjunct professor at Stanford University, considers this study to be the best one in this population to date and believes it provides confidence in the potential benefits of time-restricted eating. While the study suggests that time-restricted eating can offer metabolic benefits beyond just weight loss, especially for individuals with metabolic syndrome, it's essential for those with type 2 diabetes to approach intermittent fasting under medical supervision. In the JAMA Open study, some participants needed medication adjustments based on their blood sugar levels, highlighting the importance of medical oversight for this approach. Despite remaining safety questions, particularly for individuals taking insulin, time-restricted eating appears to be a safe and effective tool. More healthcare professionals are considering it as a viable option for their patients to manage diabetes and improve overall health.